Good morning, everyone. I'm here with my good friend Callum, and he's going to tell us about the impact that elder abuse has on society and how a particular screening tool could be implemented to help reduce that impact. So tell us about what this issue is. Well, Callum, elder abuse is essentially any action or inaction performed by a person in a position of trust that causes harm or distress to an older person. These forms of abuse can be physical, sexual, emotional, financial, or it can be neglect. Now, it's often covert in nature, usually occurring in the privacy of one's own private home. Queensland Ambulance do not currently have an elder abuse screening tool in place, although they do have a clinical practice guide in place for the care of elderly people that flags certain demographics and provides relevant practice advice around those elderly patients and patients with dementia. The Ambulance Service Act 1991, Section 8 states that an authorised officer in providing ambulance services may take any reasonable measures to protect persons from any danger or potential danger associated with an emergency situation. Why not take this one step further and do the best of our ability as paramedics to recognise elder abuse and act accordingly? Paramedics should consider the social relationships an elderly patient may have. Section 4 of the Guardian and Administration Act helps to justify this consideration. Identifying detrimental relationships between a friend or carer with an older person is crucial to recognizing elder abuse. Section 9 states that an entity performing a function for an adult must be done in a way that promotes and safeguards and is least restrictive of the adult's rights, interests, and opportunities. Consider a paramedic identifying a carer within a home who acts or makes a decision that is detrimental to the older patient's well-being. With an increasingly older population, there is a concomitant rise in individuals vulnerable to elder abuse. A recent estimate by the Royal Commission into Aged Care Quality and Safety stated 39.2% of older individuals were victims of emotional abuse, physical abuse, or neglect in residential aged care. The quality of life for victims of elder abuse is reduced, and they often suffer from psychological complications as a result. While a person's response to abuse of trauma can vary greatly based on various factors, long-term avoidance of situations that remind the victim of the traumatic experience can inadvertently result in social isolation, and a poor social network only contributes to the risk of mortality linked with elder abuse. However, different forms of abuse can affect health in different ways. For example, victims of physical abuse may have bruises, burns, hematomas, and fractures, whereas elder neglect can lead to dehydration, cachexia, poor hygiene, and pressure sores. Elder abuse is a considerable public issue that puts strain on the healthcare system and economy. It was estimated that elder abuse costs the Australian economy as much as $30.7 million in 2007 and 8. As part of the response to the increasing epidemic of elder abuse in Queensland, QAS paramedics deem it necessary to introduce an initiative to assist in detecting and responding to elder abuse in the community. This will aim to reduce the physical and emotional toll on the victims, as well as the financial burden often incurred as a result of ongoing abuse. This program will be evidence-based and formulated from research and practice involving known cases of abuse. Where there is any possibility of an elder member of the community being subject to abuse, paramedics and other frontline healthcare workers will have access to a checklist to complete on behalf of the patient. The purpose of this checklist is to identify any evidence of abuse inflicted to the individual within their home environment. Paramedics would be required to complete a checklist comprised of 6 sections to flag possible victims of elder abuse. The checklist encompasses the 6 areas in which signs of elder abuse are evident in previously documented cases. That is, psychological, financial, physical, social, sexual, and neglect. The checklist can be completed without direct input from the patient and only requires a yes in one section for a referral to be presented to a QAS social worker who will be able to aid in the individual receiving compensations of all types, being legal, medical, financial, and social. There is an easy-to-follow flowchart that accompanies the checklist to make the process seamless for QAS paramedics to refer to advise necessary parties of the next step involved, including what to do should the patient not have capacity or refuse to consent to further action. It is this multidisciplinary team approach that over time will aim to reduce the occurrence of elder abuse and the physical, mental, and financial burden on the victimized individuals and communities. The goal of our screening tool and flowchart is to identify instances of elder abuse in the pre-hospital setting and respond to them in an appropriate and timely manner. This tool will work well in conjunction with other tools utilized in community and hospital settings, as there is a need for identification of abuse in the pre-hospital setting. Screening tools have been used to good effect in hospitals and community care, and we believe our tool can add to this network of elder abuse awareness and identification. The benefits of our screening tool are that with its implementation, instances of elder abuse are more likely to be identified and acted upon appropriately outside of the hospital setting. Screening tools offer a streamlined approach to detecting issues with an easy-to-follow format that any practitioner can use without difficulty. Screening tools for elder abuse have been found to be effective for identifying and responding to elder abuse within a hospital setting. The introduction of these tools into pre-hospital care will be useful, as this will help identify instances of abuse earlier and in the home environment where signs are likely to be seen. This tool is cost-effective, as screening tools are affordable to develop and implement and require short training to establish the required skills to use effectively. This tool will help paramedics when they are faced with situations involving elder abuse, as it offers clear guidelines on what is elder abuse, how to report it, and how or when to escalate to police services. By clarifying what elder abuse is and how to identify it, paramedics are more likely to identify instances and bring about change to help the affected persons.